Kind of a quiet start here today, but we have a quorum, so I think we're going to go ahead and get started. 8:30. Um, so the official notice of the publication in the Daily Record, or there is official notice in the of the publication in the Daily Record. The Open Meetings Act is located on the north wall of the legislative chambers. Let's go ahead and do a roll call.
Wade,
Here.
Festerson,
Here.
McNally,
Here.
Rogers, Weiss, Jones, Wilkin,
Here.
King, Espinoza.
Second item, can we get a motion to approve the minutes from last month's meeting?
Second.
Second.
Wilkin,
Yes.
Wade,
Yes.
Weiss, oh, she's not here, sorry. McNally,
Yes.
Espinoza, Festerson.
Yes.
Then the approval of the action items. Can I get a motion to approve all items A through I together in one?
Second, Festerson.
Second, Festerson. Roll call.
Festerson,
Yes.
McNally,
Yes.
Wilkin,
Yes.
Espinoza,
Yes.
Wade.
Yes. All right, so we have a few presentations today. First one today, Communications Department report.
There it is. Okay.
Good morning.
Oh, ma'am.
Morning.
Okay.
Okay. Good morning, everybody.
My name is Pitige Klahar. I'm the supervisor of health communications. Today, I'll briefly cover how our Facebook communication supported public health from January this year to present, how communications support health outcomes, and what our highest engagement posts tell us about our community needs, and how we are applying those lessons moving forward. So communication matters because residents are flooded with a lot of health information, some of which are inaccurate. So our role is to be timely, accurate, calm, and local. Local meaning we try to put them, link them to resources that they can relate to in our area and not just on a wide scale basis. Our Facebook remains one of the largest direct to residents channel, especially for our parents, or older adults and caregivers, media partners. And on the right, you'll see a breakdown of our audience. On the left, you'll find the women, and on the right, male. So our Facebook Snapchat from January January this year to present shows us that we have a 4.1 million reach. Our views per breakdown is split in half, wherein that organic reach, which is reach that we did not pay for, is 2 million, and then the advertisements is 2.1 million. Average, we see monthly views of like 250,000. So our takeaway from this is that our residents are actively engaging in our credible local health information that we feed them. At the bottom, you'll also see the diagram of this. So what we noticed based on looking at the top content by views is that the messages that our audience respond to is weather-related crisis information, familiar faces, vaccine topics or discussions, and depression and anxiety. At the diagram on the top there, you will see that a national weather advisory report went out for some heat crisis that we had. We had to tell people how to prepare. And that received 91K because there was 120 shares. Mark you, our Facebook followers is roughly 14,000 followers, right? So it shows that we're reaching beyond just our followers, which is the target, is to make sure that we have a wide reach. So the next thing is the Detox Sober Lounge. This is Alexis, that's the second column. This is Alexis Lawson, the founder of the Detox Sober Lounge. The audience was able to connect with her because she's a local resident. She is going through detox. She's also a speaker a motivational speaker, and the audience who responded was able to relate to her, either sharing their own stories in the comments or actually saying how they met Alexis. Moving to number 3, we had the COVID and flu vaccine post that we did. This was in November. We had 36,000 views. Some of these viewers were not even in Douglas County, but throughout the rest of the United States and also across the world, like even Canada. We had 2.7 reactions, so that is like likes, different type of, the emojis, and then 1.8 K comments. There was a discussion in that some were for and some were against. And so we were able to see what was on people's minds and then make plans on how to educate or how to comment and respond to any sort of misinformation that was placed in the comments. Then we have a post about getting vaccinated at birth for infants to prevent hepatitis B. It was relevant, as we know that was up for discussion recently in the news. And so we found that based off the comments, some people were pretty much misinformed, and we were able to guide them. They had questions, we were able to answer some of those questions. We have a different response to the questions that we were not able to get to in the comments, but to educate the audience broader, which I'll talk about soon. The fifth one was if you knew someone who was suffering through depression. This was an opportunity for us to point people to Douglas County Credible Minds website, where they can find tools such as either speaking to a therapist, reading materials to cope, or even just doing breathing exercise or different exercises to be able to, whatever it is that met their comfort level. Okay, so a little bit more into our videos. So we, as in my team and the clinic, teamed up with doctors in Omaha area, specifically UNMC and DCHD, to speak about some of the myths that people would put out there, to answer some of those questions. So we did a series of video clips, and this is just one of those that was posted. It received about 35,000 reach. As I said before, it just went outside of Douglas County and to other areas, even within the United States. But it was good for us to even point people in the right direction using a medical expert. And so Dr. Neiman spoke about why we need the COVID-19 and flu vaccines every year. I had a question as to why is my COVID vaccine that I got last year good enough? And so this was an opportunity to answer that question. We have Dr. Emily Deitel, who is from UNMC, and she specifically answered the question, what are the specific risks of Hep B infection for infants, and why is it important to vaccinate at birth? We got high engagement for this post as well. Lots of comments, as you see, 1.234, and lots of clicks. There was a discussion again in there, but it was also an opportunity to just understand what the audience was thinking so that DCHD could make a specific and strategic response to answering the questions. Another thing that we find is that people gravitate to when we share behind the scenes posts. So that is whether we are at outreach in the community or if we're doing something within the building, people are very happy to engage with that. We shared recently this photo of DCHD staff recently trained with Nebraska Medicine on how to safely collect samples for Mpox testing. During the training, staff practiced using personal protective equipment and following proper steps. It shows the team that we're prepared in case of anything that should come. This was also an opportunity to engage with the community because there was a question, is there a targeted audience of people who should get it as opposed to people who generally aren't at risk for this? We were able to point them to our website to get more information, but we still answered the question and let them know that it's great for educational purposes for that person and for the broader public. So why this matters? So it answered real-time questions residents were already asking. It reduced confusion during peak respiratory illness periods. It reinforced DCHD as a trusted source. We noticed that short, plain language videos featuring our medical staff consistently outperform graphics alone. People trust the faces they recognize. Here we have one of our comments. It was a top comment stating that, once again, thank you, Douglas County Health Department, for standing up for science. These comments like these is what help us put the next step and move forward. Here we have some direct engagement again. We do answer we will comment, so we don't leave our audience just guessing or just commenting. We do actively have others who watch the page, and we would definitely respond. One of the questions that was so repetitive was, how does a newborn get Hep B? and that came under Dr. Daito's video. She was able to answer some of the questions. We also answered what she stated in the video. It was great for her to interact, and they were able to get some answers. But we also thought, let's take it a step further and be strategic in how we respond. What if those persons who, what would happen if not everybody click on the comments to see if we were replying? It would be buried because we had so much interaction and engagement with this post. So we decided that we were going to make a single post and answer that question and post it on a different day. Another way that we are trying to educate is that creating Facebook banners as an educational tool, asking a question and having one of our medical experts answer the question. These are questions that come from comments that are made, and we are not able to always answer, as you see, 1,200 comments. And so we are able to use this as a Facebook banner to make sure that we have those who didn't even see that video get educated, be educated in some of these questions that comes up over and over. When we compare our agency to agencies that are similar to us, it shows us ranking 4th. It shows us on an upward trajectory, and this is within the last 12 days. So we are definitely reaching our members of the community, and we are very happy that this is happening. It shows us that we can still answer those questions, we can educate. It's just an opportunity for us that we can be strategic. This would help us to be able to know what we're doing wrong, and we would be able to continue to do what we know works. So looking ahead, we will continue to do respiratory illness education throughout the season. We will do more short-form videos with medical leadership. We will be adding 2 communication specialists to our team to assist with our strategic efforts in reach and messaging. We also enjoy having a reach, but we want to also be relevant, have clarity, and consistency. So in closing, we understand that effective public health communication is a service to the community. Every clear message supports healthier decisions and public trust. We also want to take some time to congratulate Phil. Many of you may know, Phil Rooney was our resource specialist, and he retired on Monday. And so we are very thankful that Phil committed his years of service, giving service to public health. We want to wish Phil well. So thank you for your continued support of the work that we do, and I am happy to answer any of your questions.
Just curious.
Oh, sorry.
What is the budget for paid advertising from this?
So it depends, because we have different programs that have their budget for advertisement. And so one of the programs right now who is using advertisement is LED. But I'm not sure what their budget is. They would just utilize our platform. You want to speak? Oh, yeah. Yeah. Yeah.
Sorry.
Yeah. Come show me.
Good morning. Yeah, the LED program, and then I know that Leah also does some advertising around the city. But the LED, they utilize EPA funds with the Superfund dollars, and actually have contracted with an advertising agency. So they're doing some billboards, or will be doing some billboards, and will also be doing some commercials on local news, local stations, things like that, to get information out about lead and childhood lead poisoning.
So does the health department itself, though,
No.
ever have to pay for advertising?
We
Or, I mean, or do we advertise public service?
no, like it kind of, as Peter was saying, we don't have a built budget for advertisement. Does that help or answer your question? Okay, thank you.
this is one of the areas where we have written into the public health infrastructure grant to have some dollars targeted for expanding communication capacity. We recognize that sometimes that means spending money on advertising, but we also lean into partnerships that exist, and we're trying to standardize making sure that there is language written into all of our grants to allow for communication and messaging.
Thanks for that presentation. And I'm glad you're active on many communication channels trying to communicate clearly important public health messages, especially right now when some of those public health messages are not at all clear from the federal government. So I'm curious, in your experience, especially on the social media challenges, I know that can be difficult to communicate complex issues in a productive way. Have you found that those that are communicating with you or interacting with you on those channels, are they hungry for this accurate information, or are there a number of folks that are challenging that information? What's your experience with that?
I find it's a balance because we have some who are who brings the misinformation, are educated by some of our other viewers who will speak up and say, I got vaccinated, or on those kind of issues. We make sure that if we see a specific comment that is definitely misinformed, or experts, whether that is the clinic or the health director or the deputy health director, we have a team who actually will give a proper response to whatever it is. If it continues and it becomes overwhelming, like what we've seen with the hepatitis video, the next step was just to find another way that we could reach and answer those questions, but also educate in the future. So anyone who comes to our page, because as you saw, when we compared, I don't know if you specifically looked at that number, but when we compared the five agencies similar to us, it showed that there was a 71 upward growth of page likes just within 28 days. So it means that even if persons are not in Douglas County, but they want to learn and not miss out on that information. And to me, that is credible, that is incredible, that so much within that short span wants to learn more. And they will definitely tell you in the comments.
Mm-hmm. Good.
Any other? I only had one other question. I think you answered my other ones, but so really active on Facebook. Is there plans in the future to expand the message through other media platforms, or?
So Facebook was just a way to save some time today. We also, anything that's posted on Facebook also goes to our Instagram, and we also have Twitter, but or X. We're trying to be strategic in not just throwing the same information on all channels. We want to leave the X for like medical alerts, and so the audience can get accustomed to that. We're also hoping that when we get the other two communication specialists, we're going to start doing more work on TikTok. We want to reach that younger generation because we feel like they have an influence on the older generation who sometimes can feel very, or don't want to move a different way from the old way of, or the way they are accustomed to thinking, you know? So we feel that reaching the younger audience can have them influence their parents and their grandparents, if that makes sense.
Yeah, thanks.
I'm sorry.
Oh, no.
Also, to add to that, item H on the approved action items is a contract with a Nebraska-based company that has a social media platform that will help us integrate all of our social media channels under one umbrella to streamline our communication channels and allow for us to use and leverage all of those sites and pages in a more effective and efficient way. So I think that is a way that we are trying to be intentional about being uniform in how we use all of these platforms and add some intentionality behind it.
Okay, awesome. Thanks for your information. All right, if there's no other questions,
No more questions?
thank you.
All right, you're most welcome. Thank you for having me.
Yeah, absolutely, thanks. Next presentation, Women, Infant, Children Department Report. Cassandra?
Okay, there you go. Thank you. All right, good morning. I'm Cassandra. I'm the Douglas County WIC Supervisor. I'll be sharing a little bit. Oops. How do I advance, Heather? Oh, there we go. Okay. So for starters, in fiscal year 2025, so the year that just ended, the end of September, we had 23,203 unduplicated participants, which was an increase from the previous fiscal year. And then the breakdown of the different participant categories are there, as you can see. So we are moving in the direction of increasing participation. However, our funding for this year at $4,313,784 is actually about a 15% decrease from last year. So as they say, we're doing more with less, or assuming the participation continues to increase. That is, I need to talk louder. Yeah. Okay. Okay. And then, of course, some of that funding does go to our subaward clinic services organization, so Charles Drew One World and Nebraska Medicine. About a quarter of that funding goes to them. So outside of just what our WIC clinic staff does every day to enroll participants and provide the nutrition education and the benefits, I just want to touch a little bit on some of the other things we've got going on in WIC. So as far as breastfeeding programs, we have our pump program and our breastfeeding classes, which are overseen by our breastfeeding coordinator and our IBCLC, Deanna. So in fiscal year 2025, she loaned out 20 multi-user pumps through that program. So these are hospital grade multi-user pumps kind of for temporary use. So typically those are going to moms with babies in the NICU, and they're just used for a short period of time as needed. 12 single-user pumps were issued, and those are actually individual use pumps that are given at no cost to the client. And 8 of those came from our pump access program. So we have an MOU with Milkworks Omaha, where they help provide some single-user pumps just to increase access for our moms to be able to get electric pumps when they need them. And then 4 manual pumps were issued. 4 classes are typically offered each month by Deanna. Those are all taught over Zoom, so trying to be very easy to access for our participants. We did add a Spanish class in October, so our community health worker, Delia, interprets for those for Deanna to be able to teach those in Spanish. We had 186 enrolled in those classes, and then 78 women actually completed the classes last year. And these are our breastfeeding peer counselors. So we collaborate with the Sarpy-Cass Health Department to be able to have a peer counselor program in Douglas and Sarpy County. We have Sarah as our bilingual peer. Dawn has been with us for a couple years, and then Hope has been with us for going on 4 years now. So it's been really great to have that partnership and kind of have that long-lasting partnership to be able to have peer counselors for our moms. So 326 moms participated in the peer counselor program in 2025. 517 were referred to our lactation consultant, Deanna. So those referrals typically come either from the peers when they are working with a mom that's maybe got some needs outside of their scope. They also can come from our clinic staff. If they have a mom who kind of has some additional needs, and those are either to participate in one of her classes or if they need a breast pump or need a one-on-one assessment and help with some complications. And then we have a separate subboard from the state to operate the peer counselor program, and that is $141,602. But then again, a portion of that does go to the Sarpy-Cass Health Department to be able to pay the peers and provide the administration portion of that. We also work with Salvation Army. They have an early Head Start program, and we do nutrition assessments for them as part of their early Head Start program, as well as provide an annual staff training. We have a dietitian who reviews their nutrition questionnaires and anthropometric data that they provide for us, provide to us. So parents will agree to fill out a release of information so that we can share information back and forth. And then the RD takes a look at those, and then we'll provide guidance and any appropriate education materials for the early Head Start team to then share with parents. And a lot of times those are the kind of the same messages they're getting in WIC, so we're kind of duplicating those same messages, and that can be really helpful for parents. So she completed 124 of the nutrition assessments last year, and then of course they provide us with some additional funding, as you can see there, just to account for our time spent on those. It's also a good partnership because then they kind of know if then maybe they have fallen off the WIC program, if they're due for a recertification, and then can kind of help facilitate them getting back into WIC as well. And as you know, we do offer lead screenings in the WIC clinics. So any child 1 or over at all of our main clinic sites, we offer lead testing. So if they haven't had that done at their doctor's office in the last year, we do that right on site. In Midtown WIC, they completed almost 1,500 lead tests last year. West Omaha was at 635. One World completed 209, and Charles drew 307. So pretty good amount there. And then also the lead program then does provide some funding to account for staff time for those as well. So at Douglas County, in the Douglas County clinics, it's 0.1 FTE for those. And we also have been working with Whispering Roots. We've actually been working with them really for several years, pretty much since we started our WIC Farmers Market Nutrition Program. They've been a big supporter of that, and they recently applied for and received a WIC Chow grant. So it's for community innovation and outreach to boost WIC participation by funding innovative outreach efforts. The first part of that we've been doing, they use some of that funding to purchase produce boxes that we have been able to give out at outreach events. So Dahlia, our community health worker, attends outreach events in the community on behalf of WIC. And just in October and November when we started this, she has given out already 220 produce boxes. I think 3 of them were baby shower events. One was a health fair. She's also had gone through training with our state WIC office to be able to use our system to schedule appointments, so she can actually just get people signed up right there for WIC if they are potentially eligible and wanting to, or if they're due for an appointment and have fallen off. So that has been really great. Another piece of this, we plan on having Whispering Roots get some of our WIC outreach materials translated into some different languages. So typically our state office provides outreach and other materials only in English and Spanish. And of course we know we have a lot of other languages that our community speaks. So that's kind of next on the list of things to do for this. They also have been, as I said, just really supportive of our farmers market nutrition program. And then when the state decided to not continue doing that a few years back, they really stepped up and wanted to find a way for us to be able to still offer, locally grown produce to our participants. So they secured funding, and the last 2, maybe 3 summers, we've been able to offer our WIC families, if they went to the farm stands at Highlander Marketplace or One World, that they could get $50 per month in produce. So that's been really amazing. That's actually more than they were getting through the WIC FMMP. However, we are working on potentially trying to bring back the WIC Farmers Market Nutrition Program. We've kind of been talking about how we might be able to do that, and hopefully maybe this summer or sometime soon we would be able to do that, and I'm sure continue still to work with Whispering Roots as well. So more to come on that. And that's really all I have.
Questions? Go ahead.
Thank you. For the nutrition assessment that you're doing with Salvation Army, what are you learning from that assessment, and how is that data being used?
So I don't know that we really do anything with the data. It's really, I think it's something that they have to do as part of their requirements for early Head Start. So I think the biggest thing we see is just it's a lot of kind of the same risk codes that we see in our WIC population. A lot of them are it's the same clients, but we just see a lot of those same risks that we are pretty common when we do their WIC certifications.
And what are those? Because I'm not aware.
So, gosh, I'm trying to think. A lot related to growth. Either low weight or short stature, things like that. Using inappropriate use of bottles, so staying on the bottles for an extended period of time, not meeting, the appropriate amounts of, what am I trying to say? The number of servings of, the different food groups that they should be getting every day, things like that. Those are probably some of the most common ones.
So is the only purpose of Douglas County being involved is that provide a registered dietitian?
For the most part, yes.
And you're not using that data to try to provide any types of solutions or address any of the issues that come up with these, what do you call them, scores, risk scores? Is that what you're calling them?
So, yeah, so basically it's just to reinforce those same nutrition messages, but we don't actually do anything with that data.
That sounds like a missed opportunity.
Okay.
For the child grant, how long is that grant, and what's Douglas County's purpose on it as a partner? Because I don't think I understand.
Yeah, so it is, I believe it's a 2-year grant. I want to say it started in July. So really it's just to increase, hopefully catch more of people who would be eligible for WIC that maybe aren't participating, and really target some of those populations that, really should be participating in the WIC program, and try to get more individuals in the higher needs communities to enroll in the program.
Okay, and when did this grant start?
I want to say it July.
This year?
Yes.
And what have you found so far with your community health worker being involved? How many people have been enrolled since they've been a part of this? You're talking about that they are distributing produce boxes. Is that all they're doing?
So far, that's been kind of the main activity. I don't have the numbers in front of me, but I can get those for you.
Yeah, that would be great to see. I mean, I think we have to, I just want people to, I want you all to think about when we're a part of these grants, what is the purpose other than just providing a human resource? But how can that data be used? And how can we continue to help address the outcomes that maybe, like you said, are high risk, at risk, rather than just we checked a box and we provided a nutritionist, we checked a box and we provided a community health worker. Does that make sense?
Yes.
And then what's the barriers for bringing back the WIC farmer's market? Because I didn't hear a clear date. I didn't hear a clear strategy. It's just, yeah, we might bring it back.
Yeah, so we've really just started conversations. Leah and Sarah at SRPCAS Health Department have been talking to, yeah.
Sorry for my tardiness.
Okay.
School drop off today.
Same.
So we're excited to start kind of revitalizing, hopefully, fingers crossed, the farmers market initiative. Over at SRPCAS Health Department, I've been working with Sarah Schramm. We've been talking with Department of Ag, and in the past, the reason it ended was due to DHHS and the workflow at DHHS overload potential. So we're working on finding avenues that we can provide the funding to have that, so it may solely be within SRPCAS Douglas counties to try and showcase the benefit that it shows to our community members.
Okay.
So
that sounds good.
Yeah.
I think it's a great thing to try to bring back given our
we
climate.
really want to, so we're having those early conversations now, but just letting folks know, like, we're hoping, keeping our fingers crossed.
Do you feel hopeful that it could start up again next year sometime?
I'm cautiously optimistic.
Okay. Fair enough.
Okay.
Thank you.
Any other questions?
I have one. Thank you for the information. The breastfeeding peer counselors, can you just tell me kind of what they do, and do they assist any or hold any groups that others could attend to that may not be part of the WIC program?
So they really just provide peer-to-peer support. They're all moms that have breastfed their own children, and they're really there for encouragement and to just kind of for the moms to have someone kind of to lean on as they go through their as they're on their breastfeeding journey. And unfortunately, just WIC rules, they really can't provide their services through the WIC breastfeeding peer counselor program to women who are not enrolled in the WIC program.
Okay, so, thank you.
All right. Any others? No? Seeing none? All right. Thanks for your presentation today. Next presentation is going to be the Food and Safety Compliance Department report. I think Adam has some enlightenment here for us.
Can you guys handle a third presentation? It's a lot. Do we need to do like the head, shoulders, knees, and toes dance? Justin can lead. Just my arrows to...
Yeah, or just hit the enter key.
Why is that not working? I learned last time I let her go back there. Thank you. Good morning. I'm Adam Carlson, Supervisor Food Safety, here for a program update on food safety and compliance. All right, Douglas County Food Safety and Compliance inspects any establishment that handles food except for those that you see in that last bullet point, which are manufacturers, warehouses, and food services for medical patients. Those inspections then go onto our website, DouglasCountyFoodInspections.com, for public viewing. Douglas County Food Safety and Compliance also performs non-routine duties such as responding to complaints, performing plan reviews for new food establishments, performing CO inspections for the city, and performing liquor inspections for the state of Nebraska, to name a few. We have 13 employees in the program, including a supervisor, 10 inspectors, which include 2 EHS2s, essentially our training officers, and 8 EHS1s. We have 1 food safety consultant and 1 secretary. I am proud to say that since November of 2022, only 1 employee has left the food safety and compliance section. Also, all 10 inspectors have received the registered environmental health specialist credential, which is a far cry from a couple years ago when I did this presentation. We had 6 employees that were there for under a year. So happy that we've been able to keep our staff around. With a metro population of about 1 million and 14 to 15 million people visiting our area each year, all of which have to eat and drink, our section serves between 15 and 16 million people yearly. You're seeing a breakdown of the different types of inspections that the program performs. To date, the Food Safety and Compliance team has performed 5,533 inspections. This does not include non-routine inspections such as complaint investigations, certificate of occupancies, and liquor inspections. In 2025, we conducted 389 food and nuisance complaint investigations and received 100 foodborne illness complaints. Luckily, none of those led to a confirmed foodborne illness outbreak. I want to give an update on our Cultivate Food Safety program, which was born in 2023. Our program purpose is to cultivate a collaborative food safety culture between Douglas County Health Department and Douglas County food establishments through implementing active managerial control methods. So typically the Cultivate program is applied to poorly performing food establishments as an intervention, but we also offer this program to any food establishment on a volunteer basis. The services provide one-on-one training with the employees on food safety and one-on-one training with the person in charge on active managerial control. Active managerial control is simply the person in charge performing daily checks on food safety and documenting the results. This essentially gives ownership of food safety to the person in charge and helps create a food safety culture between the inspections they receive from our department. In the last 2 years, our food safety consultant has performed 128 consultations with 59 establishments. Unfortunately, only 4 of those were on a volunteer basis. This program is somewhat in the pilot stage still, and we do hope to advertise more aggressively once we've refined this program. Cultivate has been on pause since September, as that one person we did lose, the food safety consultant slid into that position to take that role. We have hired a food safety consultant position and are excited to welcome the new member to our team this coming Monday. The person that we ended up hiring for that position is actually a bilingual science teacher at Omaha South right now, so we're really excited to have them because they have the background in education, creating lesson plans, so we're really hopeful that this person will flourish in this position. If you look at our logo, our last food safety consultant, Rhodey, created this logo with the help of Connie, our retired communication or graphics specialist. You'll see the chef's hat on the right represents the food industry, while the clipboard on the left represents the regulatory agency. In the top middle, you'll see the handshake symbolizing collaboration between each to achieve compliance, which is represented by the shield with the check mark. It is surrounded by a wheat wreath symbolizing reaping the rewards of collaboration by both parties. Since 2002, the Douglas County Health Department has been enrolled in the Voluntary National Retail Food Regulatory Program Standards. That's a mouthful. There are 9 standards, but I'd like to touch on 2 of them today. First, Standard 2, which sets criteria for training regulatory staff. The standard consists of 5 parts: pre-inspection curriculum, initial field training and experience, post-inspection curriculum, field standardization, and continuing education and training. I'm proud to announce that for the first time in our history that we have self-assessed as meeting Standard 2. Meeting the standard reflects our commitment to providing our food establishments with accurate and consistent inspections from properly trained and knowledgeable inspectors. A big reason we were able to meet this standard was from the hard work of our EHS2, Sarah Pastillo and Dan Ludwig, who were tasked with training and standardizing the inspection team. Sarah is also the lead on Standard 2 and tasked with ensuring inspectors have completed the proper training and curriculum and maintaining their documentation. Standard 9 involves a program assessment, which requires performing a risk factor study, analyzing the data, and completing a report, and finally implementing an intervention strategy. In this graph, you'll see 2 data sets, one from 2015 to 2019 in the blue, and another from 2020 to 2024 in the purple. This graph shows the percentage of out-of-compliance public health interventions and foodborne illness risk factors. 1 through 29 that you see on the bottom there are public health interventions, and the 5 categories to the right are foodborne illness risk factors. Those risk factors are categories of the public health interventions that are similar to each other. Like, for example, poor personal hygiene includes number 9, no bare hand contact with ready-to-eat foods, and number 10, adequate hand washing facilities. The top 3 violations from 2020 to 2024 were number 16, food contact services cleaned and sanitized at 55.2% out of compliance. So over half of the establishments we inspect are out of compliance in that risk, on that public health intervention. Number 10, adequate hand washing facilities supplied and accessible at 42.5%. And number 28, toxic substances properly identified, stored, and used at 30%. The final piece to meet the standard is to apply an intervention. This intervention does not have to be applied to the top out of compliance risk factor, only the one that we think will be the most impactful. So we honestly are considering the upcoming food handler training requirement as our best intervention, which I'll speak on shortly, but is not specific enough to meet the standard. So we're also applying this checklist to any food establishment that is found out of compliance with number 10, adequate hand washing facilities. This checklist will not be required to be used by those establishments, but only provided as an opportunity for improvement. I'd like to thank data analyst Hong Zhang for putting together the data for this study. If any of this board would like to view the entire risk factor study, I have a couple hard copies with me today. Otherwise, you can email me or Heather and we'll provide that risk factor study to you. In this year, the state of Nebraska adopted the 2022 Food Code, which allowed local jurisdictions to allow dogs on food establishment patios without a variance. In July, this board removed the requirement for a variance, and to date, 0 complaints have been received regarding dogs on patios, reflecting an accepted and welcome change to our community. One of the health department's core values is innovative excellence, and the food safety and compliance section has made great strides in this area. In 2025, we partnered with the City of Omaha's planning department to allow us to access their Acela software. This allows our inspectors to log into the software and get notified of scheduled inspections and submit the results of the inspection in real time. Previously, the city emailed our secretary, who forwarded it to the inspector. The inspector then printed it off, the report, and provided it back to our secretary after the inspection, who then scanned it back in to the computer and emailed it back into the city. This resulted in a delay with the certificate of occupancy being granted to the operator, sometimes by a few days, if over a weekend. Now the city is notified of our results immediately. I'd like to thank Stu Craven with the City Planning Department for his help in achieving this. We're also merely weeks from launching our new inspection software system. This system will allow us to go completely paperless and in time allow for online applications for food permits. The software will also eliminate severe inefficiencies such as duplication and triplication of efforts by automatically updating stakeholders, such as the Nebraska Department of Agriculture and the Douglas County Health Department Business Office with our required reporting. It will also send food establishment operators valuable information. This photo shows Environmental Health Specialist 2 Dan Ludwig with 1 year's worth of inspections that we have to print out to submit to our secretary so the ratings list can be updated. This is only half of the paper inspectors have to print out, as they also had previously had to print out the inspection to give to the operator after the inspection was done. Both are now handled paperlessly by Inspectigo, as the reports are emailed to the operator and the system automatically updates the ratings list. So if you double amount the paper that Dan is holding and then times it by 10, that's the amount of paper Inspectigo is saving on inspections alone, not to mention any digital application paperwork that we'll be saving. Speaking of establishment ratings, our current rating system of superior, excellent, standard, and fair, fair, and below minimum standards is desperately in need of an overhaul. The method is subjective, inconsistent, arbitrary, and unclear to the public on its meaning. For example, if you read the difference between excellent and standard, excellent is the establishment routinely corrects most sanitation deficiency and immediately corrects the minor violations found at the time of the inspection. Standard is the establishment generally corrects most sanitation deficiencies on a routine basis and corrects violations found at the time of inspection in the time allowed by the inspecting health officer. I'm the supervisor of food safety. I don't even know the difference between those two. So you can imagine that the public's not going to know the difference of those two. Also, when an inspector is in an establishment ready to assign the rating and they're in between an excellent and a standard, it's really just subjective on which one they're going to give the establishment. So you can see why this system's not so great. Furthermore, if a member of the public just sees the rating standard by itself, standard compared to what? They don't know what the other ratings are. It doesn't tell them really anything. So where did this rating system come from? As far as we can tell, it's been in place since at least the 1950s, where back then you could send a letter in with $1 to the health department and request receiving this book once every 6 months. You'll see on there that the ratings are similar. It's a little bit different. They have excellent and good, and then apparently if the inspector couldn't decide between excellent and good, they rated it an excellent good. The new rating system, A, B, C, D, and F, is objective, consistent, data-driven, and is a familiar concept to the general public. The rating is automatically assigned by Inspectigo based on the formulas you see here. The formula also considers the number of repeat violations into the rating. For example, 3 or more repeats of a priority violation results in the lowering of 1 letter grade. Now on to the big changes. New in 2026 is the requirement for certified food protection managers and food handler certifications. First, the CFPM. The requirement for the CFPM was passed into local ordinance, but also passed into state law last April. This law requires every food establishment to have a CFPM on staff. Douglas County does not have anything to do with the training and certifications of CFPMs. These certificates, by law, must be received from one of 12 ANSI accredited entities. It is important to note that the CFPM only has to be on staff, not on site. Food handler certifications were passed in the local ordinance on August 26th of this year. All food handlers in the city of Omaha will be required to obtain a food handler certification, specifically from the training portal provided by DCHD. The training must come from our portal as we information that pertains to rules and regulations specific to Douglas County. We have partnered with the University of Nebraska-Lincoln to create the online training portal. There are 3 different levels of training depending on the duties of the position: serve clean, prep cook, and shift manager. All 3 levels can be obtained for a single fee of $20, and if you're under the age of 18, you're eligible to have the fee waived. The ownership of the certificate stays with the employee so they can take it with them if they move jobs. The training will initially be available in English and Spanish with intentions of creating more languages with revenue generated from the program. I do honestly have to say this training put on by UNL is some of the best in the country. The first time I saw it, I immediately thought we have to have it. So I encourage you guys, and hopefully I can provide you guys a free link to that training once we have it available. It really is something special. So I'm extremely excited to bring it to our community. Permit holders are required to ensure that they have the minimum staffing for their food establishment. So for establishments that are handling exposed foods, a certified food protection manager must be on staff, and a certified food protection manager or an employee with a shift restricted manager certification must be on the site during all hours of operation. For establishments that only handle prepackaged foods, a shift restricted manager must be on staff, and a shift manager or an employee with any level of food handler certification must be on site during all hours of operation. They'll also be required to provide employee logs with pertinent information, and lastly, they'll be required to maintain copies of all employee certifications. So when is this going to happen? Our original goal was to have the internal go-live date of this Monday. Excuse me. However, last week UNL communicated they were roughly 2 weeks behind, which pushes back our internal go-live to December 29th. We will do a soft launch that includes internal review and bringing in some of our external stakeholders to test the training portal. We have a hopeful citywide go-live date of January 6th. However, we have made no external commitments to that date. And with us not being able to test the training until December 29th, pushing the external go-live seems likely. Nonetheless, whenever we do know the official go-live date, we will do a large-scale media release to inform the public of the expected requirements and the availability of the training. We will then give food handlers approximately 6 months to comply. I'd like to thank DOTComm, UNL, DC Treasurer's Office, Grant Street, which is the payment portal system, and the Douglas County Health Department Business Office for their work on this project. We didn't know if this was a reality until August 26th, and we made our goal of a go-live date January 6th. So for any of those who know what it takes to move things through government while dealing with multiple stakeholders, you knew this is an extremely aggressive goal. Relative to how fast things move in government, this team worked at the speed of light. Most credit goes to Sybil Spencer-Hilton with DOTComm for coordinating everything and keeping things on schedule. I'd also like to thank this board for supporting the ordinance. I'd like to thank Mr. Wade, because without your stamp of approval, it wouldn't have happened. I'd like to thank Mr. Festerson for being our public health champion on the city council. And if you saw any of that city council, you know it wasn't really, it wasn't an easy feat to get passed through. Here's our team, picture of the team at Junkstock, our biggest temporary event of the year. Junkstock has over 60 food vendors and is one of the only events that requires us to dispatch the entire team to the event. I'm going to get myself in trouble, but I do want to say that this team has the hardest job in the health department. I truly believe that. They're the hardest working, the most dedicated team. And you saw it, 5,533 inspections in 1 year by 10 people is amazing. A couple years ago when I gave this presentation, we were kind of, relative to other health departments in the nation, we were kind of in the back of the pack. Over the last couple of years, because of the work of this team, we're in the running for the front, and I fully expect in a couple of years when I give this presentation, we'll be leading the nation and setting the standard for food safety food safety and compliance. So thank you, and with that, I'll take questions.
I know you haven't done the launch yet or the trials. How long are you expecting that training to take?
For the individual taking the training?
Yes.
The 3 tiers take approximately 2 hours apiece. So if you're only taking the first one 2, second one 4, third one 6.
Thanks, Adam, for that presentation, and I appreciate your passion for this topic and all the updating you're doing in this area to bring Douglas County into the next century here. So a question for you and then a comment. I think, as you noted, bringing this to the City Council took a little extra work and took several more weeks of conversation about some of these topics, probably most readily the food handler certification and how that would work with local restaurants and training that you're getting ready to launch here. One thing we did tweak a little bit was how it handles summer employment and folks that are young people that are seeking summer jobs and would have to go through this training too, which is still required, but I think we waived the fee. Do you want to talk about that a little bit?
Specifically, how the City Council responded to that, or just what we did?
Yeah, the end result.
We took this to the City Council with no waiver for any age group, and also only one way to pay for the training, which was an online payment portal. So with feedback from the council, we added the waiver for anybody under the age of 18, and we also provided more payment options. If a person comes into the health department, they can pay in cash, check, and money orders, cashier's check, along with the payment if they can't do the payment portal online.
Mm-hmm. I thought that was a good response to that concern. And for those that may have trouble, affording that training. And the end result was good. We had a nice conversation for several weeks there, but like I said, strong passage by the City Council. I also want to compliment the Restaurant Association for their involvement. It was very important that you had that engagement up front before it came to the City Council. And I will say I had the opportunity to shadow a restaurant inspector too during this process, and it was really educational for me, if anyone is interested in doing that as well. And what I observed was it was very productive. It was a partnership. We're a regulatory body in that respect, but in the restaurant where I participated, it was a very productive conversation about just making sure things are done in a safe manner and following public health guidelines, and I thought it was a great example of your work.
Yeah, thank you, and absolutely, if any of you have any interest in shadowing an inspector, I can set you up with Sarah, truly one of the best inspectors in the nation, and she's happy to take you out, and I think it's pretty eye-opening for anybody that shadows one of those inspections.
Yeah,
that we're not just out there, regulating and telling people they have to do things, or else. It's a collaboration and education along with that.
And when does the new rating system go into effect?
When we get the Inspect and Go system up and running, it's built into that system, and I hope to have that. I'm going to be doing some field testing with that in the next couple of weeks, and then if it goes well, we'll roll it out to all the inspectors in I'd say approximately a month. That is subject to hiccups, so we'll see.
Mm-hmm. Good. And then lastly, I'd just say that we've also subsequently adopted the livestock ordinance and the fowl ordinance in Douglas County through the City Council. So I've enjoyed working with your staff, and I think you're doing a good job of updating all of our situations here through the city process.
Yeah, credit to Eric on that one, Mr. Bradley on that one.
Yeah. Thank you.
Thank you.
Thanks for your presentation. Appreciated that. For the food handlers, is it required to be renewed, and if so, how often?
The certificate lasts for 2 years, so yes, it'll have to be renewed every 2 years. And the good thing about that, though, is once you pay that initial $20, you can log back into the system during that 2 years and retake the training as often as you need. But we do want to see that actual certificate renewed every 2 years, just because I mean, really, if you don't use it, you lose it. Mantra, it really applies to situations like this.
So if they logged in like before their 2 years is up, they would be able to get it renewed at that time, and they wouldn't have to pay? Is that how that?
That's something I'm trying to work through with UNL IT team to see if we can't do. Unfortunately, right now, it won't renew that certificate until you repay the $20 and redo the certification. Because that question was raised, well, can they come in a month early before it even expires and get it done? That's something we're working through right now.
Okay. And then about the Cultivate Food Safety, you had mentioned like there were a certain number of consultations that were done. Can you just walk us through like what does a consultation look like? Does somebody have to request this, or is this what's the process?
Yeah, so like I said, for the most part, it's applied to poorly performing is food establishments that perform poorly on their food inspections. So if the inspector goes in, they do poorly. Standard protocol is we schedule a follow-up. If that inspector goes back and there was no improvement on that follow-up, previously one of our only options was closure to kind of drive the point home. Now we have an alternative option of, okay, now we're bringing in our food safety consultant. They're not regulatory whatsoever. So a lot of the times with an inspector, people answer things not completely honestly because they're nervous they're going to get in trouble.
Yeah.
The idea with the food safety consultant in a non-regulatory role is they come in, no matter what that food establishment, however they answer the questions, they're not getting in any quote-unquote trouble for that. So we find that we can get down to the more core of the problem because they're more willing to be honest with a non-regulatory person. So then that person has conversations with the establishment, asks a bunch of questions about how they do things, and then they'll spend more time in that specific establishment than an inspector will and observe what they do. And then they'll cater a food safety plan to that establishment, specifically to their processes. So it's not just a general, in general, this is how you should do something. It's like, this is how I see you guys do it. This is what's going wrong. This is how we correct that, and this is how we do it right. And then they'll do some training with the person in charge on how, on active managerial control, on how that person in charge is going to check those things daily, document them, and essentially be their own quote-unquote inspector every day in between our 6-month interval inspections.
Oh, okay. That's nice. Last question. For the, I'm kind of backtracking, is it CFPM,
Yes,
the
ma'am.
manager? You had mentioned that they need to just be on staffed and not on site, but then there was a slide that said, I don't know, I couldn't understand what was going on there.
Yeah,
So
those slides are a lot until you break them down. So they don't have to be on site, but they either have to have a CFPM on site or a shift manager, which comes from the training that Douglas County provides. So if the certified food protection manager is there, great, they've satisfied the requirement. If the certified food protection manager is not there, they need to have a shift manager on site.
On site.
Mm-hmm.
And then if it's prepackaged foods,
then they only have to have a shift manager on staff and any level of food handler certification on site.
okay, that makes sense. Okay, thank you.
Hi, thank you again for your presentation, and congratulations to you and your team. You guys have made great updates.
Thank you.
For the whole program. 2 questions in regards to food handler certifications. Is that only for Douglas County, or is that for the state of Nebraska that's going to be required? And then also age requirements. How young are we talking about? I know you said under the age of 18 it will be free, but what is the age requirement?
Yeah, the first part of your question, it's actually only required for the city of Omaha and the 3-mile ETJ because it's through the Omaha City Ordinance, not through a Douglas County law whatsoever. So Ralston, Valley, Waterloo, and anything outside of the city of Omaha, we actually can't require it. We'll strongly recommend it, but we can't require it. So city of Omaha for the food handler certifications, city of Omaha only. Second part of your question, if they're in a food establishment and handling food, typically you usually don't see anybody younger than 15 or 16. But no matter what, they can have accidentally cause a foodborne illness. So it doesn't matter how young they are, we would expect them to have this training. Now, if we run into somebody really young, we might have to take that situation one by one and see what we can't figure out. Maybe maybe we might waive that requirement with some making sure they're supervised by a certified food protection manager or a shift manager. That's not something I've thought of, so thanks for that question, but we'll think through that. And we'll be very flexible with any of this on a case-by-case scenario.
Thank you.
All right, I have a few. But overall, I think super excited about the training coming. Also, totally agree with, I think it's been a great environment with the inspectors not being regulators, being educators with the businesses in the community. I think that's been huge. How are you feeling? So with the 5,000 inspections, how are you feeling with the number of inspectors that you have? Are you able to get through those, stay on? So we're doing every 6 months right now. I know at times years ago, we really fell behind at point when we were understaffed, where I think it went sometimes up to a year before an inspection would get able to be completed.
Yeah, so I've, as a supervisor, set a extremely aggressive goal of being 99% caught up on routine inspections, which I think in February of last year we achieved, and we've been slowly falling off that. We're at about 95% caught up right now, or on schedule for routine inspections. If the inspectors, if everything goes right, no deviations to their plans, we can get those done. But usually that's not the case. So the hope is with some of the revenue with this food safety certifications coming in, one, our inspections are going to take a little bit longer, about 10 or 15 minutes longer per inspection, times 5,000, that's a lot. So we'll need more staff. So hopefully with this food safety certification revenue, we will be able to hire more staff. My goal is to hire 3 more people, which would, I think, make us successful. I don't know if Justin's glaring at me right now, if I should have said that, but my hope is 3 more people, and I think we'd be adequately staffed with 3 more people.
Okay. And I noticed their slide, we were talking about completing the consistency training between all the inspectors or getting the compliance. I guess, can you refresh that on that? So you're talking about, you have the 2 number 2s that then get standardized, and then they train the rest of the inspectors to be consistent.
I think you're referring to when I was mentioning standard 2 of the voluntary retail standards.
Yeah.
Yeah, so the EHS2s are what they call standardized by a state field supervisor from the Nebraska Department of Agriculture. Those our EHS2s then do field standardization on all 8 other inspectors. So standardization inspections are quite intense. They're kind of the white glove test. We don't do regulatory inspections while they're out in the field doing these because it wouldn't be fair to the food establishment. The food establishment wind up with a ton of insane violations. But yeah, so that's the process. The 2s train the 1s. And then what I didn't mention is standard 4, which is quality assurance. Those 2s yearly go out and then review the EHS 1s to make sure they're doing the inspections to standard.
Yeah. Because I think, that's great that we're going that direction, because that has been a challenge over the years, that you get differences in inspectors, especially if territories get redrawn and it's one inspector now you have a new inspector that's coming in when you've been working with the same inspector maybe for a few years, and all of a sudden they have totally different hot buttons that they're looking for that maybe have been in the establishment for a lot of years but had never been mentioned, and then you have another inspector come in and all of a sudden it's a whole nother laundry list, like how come somebody didn't bring this up to us before?
Yeah.
So those can be challenges. So getting everybody on the same page with, hey, this is what it is and how we enforce it, and this is the list of violations that come through.
Yeah, the goal is always consistency. Yeah. No matter how well you train, though, there's always a little bit of human deviation, right? Everybody has their own set of eyes and they see their own set of things. Another thing that's really helped is the consistency of our staff. Historically, food safety and compliance has been really a revolving door of employees, just because the work's so difficult. Other positions open up in the department, and usually they'll transfer over there because it's a more ideal job. The consistency of the team is crucial in the consistency of inspections.
So it seems on paper up front, it seems like a no-brainer to be going to a new grading system of A, B, C, and below. I do have concerns about that, that I think I want to make sure that that is really well thought through on how we grade it. Obviously, you don't want it to be, where it's just each inspector is going to say, oh, okay, well, this feels like about a B or this feels like an A. Hey, very clear cut, this is how you get this rating. But of course, to get that, then you need to have consistency of the inspection itself. One of the concerns that I worry about is, if an establishment ends up having a bad day, comes in, let's just say they get scored a C on their inspection, which I don't know how that necessarily equates over to current standards. So if it's a standard grading right now on the system, a C viewed by the public is, it could be a death sentence for the business. When you're looking at, hey, where am I going to go eat tonight for dinner? Oh, this place has a C. They're probably going to choose someplace else. Mm-hmm. I've known in other cities that they've had challenges with that. And then the concerns of if somebody does get a score of a C, and then now it could have just been a bad day, or maybe they're in between managers in the establishment, or they just had an employee that came in that hadn't gone through the safety training yet and made a bad mistake that somehow triggered a couple violations that got it to a lower score. Now that business is going to be stuck with a C for 6 months at best. And so if those scores are put out there, and maybe you would need to have more of a track record of what that business's ratings had been. So if they've been consistently an A for, let's just say 5 years, and then they have a bad day with a new employee and they drop to a C, and they have to wait 6 months to be able to improve on that score, could be a really huge impact to that business. And then also I would throw out there, if something like being understaffed on your inspectors, or there seemed to be a couple hiccups over the last 5 years or so where we got behind. So then maybe it ends up being a whole year that you're stuck with that C. I just don't necessarily think that necessarily is a true reflection on how that business could be performing. Now, yes, I think there's a lot of things out there that, repeat violations and maybe businesses that don't take it seriously, like there has to be some ways to hold them accountable and make sure that there aren't problems. But I think you have to look at the collateral damage too of that grading system and how that could impact the industry.
Sure.
So just want to at least throw that out there as something to make sure we
and if you reference the graphs, and I'm sorry, I'm going to be speaking mostly to Mr. Wade here, so if I get really detailed here, you'll see, so we are also changing to a priority foundation core rating, violation severity system. You're probably familiar with critical, non-critical. Have you heard of priority foundation core? Essentially, a critical was a priority and a priority foundation. For everybody here, an easy example is washing your hands correctly is a priority violation. If you don't do it, priority violation. Not having soap at the hand sink is a priority foundation violation, because without the soap, you can't wash your hands correctly. Now, if you wash your hands and you dry your hands with paper towels, and now you don't have a trash can there to throw that paper towel away, that's what we call a core violation, because not having a trash can there to throw your paper towels away isn't going to get anybody sick, but we want people to dispose of their waste properly. So I think that's an easy example for everybody of the difference between priority foundation, and core. Back to what you were speaking of, Mr. Wade. You'll see on the scale on the left, the P on the up and down scale, if you have 4 priority violations and 2 priority foundation, those were lumped together as criticals. So you could have up to 6 criticals and still have a B score. So I was pretty deliberate between our standard excellent system and this one, looking about, okay, if somebody receives a C, is that going to be a fair and appropriate score to stamp somebody with for 6 months or possibly a year if we're behind on inspections? So if you look at this, and I'd put quite a bit of thought in this, I think it is. So yes, at sometimes does it seem harsh to say give somebody a D for 6 months? It might be if you're thinking about it, but also it's very important that food establishments start taking their inspections seriously, which a lot of them do, some of them not so much. So it's serious, yes, but we want food establishments to take it seriously. I'd be happy to discuss this with you offline too. We can have a virtual meeting or whatever to discuss it a little bit more. But you also see that there's a sliding scale for larger establishments. So it's not fair to rate a small mom and pop in a large grocery store the same. So the scale on the right is a bit of a grade on a curve for the larger establishments. So that was taken into consideration also. Hopefully I answered your question there, Mr. Wade.
Just to interrupt and one follow-up. I know like 3 years ago we talked about like a follow-up fee for inspections. Is that still, I mean, is that something where
it's not. I'm personally quite against it because I believe it brings up health equity issues.
Mm-hmm.
You can buy your score, and that might not be an option for some lower income establishments. So you got the more affluent areas of town, the more affluent establishments, they're buying their scores, and some people aren't able to do that.
Last comment as far as like this grading scale. I mean, I just think that it's the way it's perceived by the public is different than what the current scale is. I'm not saying the current scale is right, but to see an establishment get a standard is not perceived the same as a C by the public. They just won't. The D's, that'll fix itself if somebody has a D and that's, easily accessible to the public. I mean, that
For the most part, if
survive.
somebody's receiving a C, that's probably going to be equivalent to a fair rating currently.
Okay.
All right, thank you.
Good.
All right, so thanks for those presentations today. I think we were able to cram 3 in. So still a director's report, Justin, today.
So good morning. Thanks for being here. It's December. I think everybody says, I can't believe it's December. I can't believe it is either. I feel like I have a lot to do yet. But I do want to thank all of our presenters today. I think you can see the commitment to public health from communication, our WIC office, and Adam and the toughest group in the department, which I was going to give him a hard time about, but I think his peers will do that for me. So I want to start by kind of echoing PETA's well wishes for Phil Rooney on his retirement. Phil was with us for a very long time as our only public information officer. He went through a lot with us, from Ebola to COVID to multiple outbreaks and natural disasters, all sorts of things. So a big heartfelt thank you to Phil and wishing him a long and a happy retirement. I did just want to follow up. We had some questions about the number of inspectors and things in environmental health. We probably, or we will be doing a budget adjustment this spring for the first time. In the past, we have not done budget adjustments, but this year it's necessary with increased revenues and things like that. So we're hoping that we can hire some additional inspectors because, in my opinion, they are understaffed and they have a big task ahead of them. I want to say congratulations to 2 of my emergency managers. Lexi Jenkins and Jack Gordon. They have been accepted by FEMA's SNS, or Strategic National Stockpile Training, so they'll be going to Alabama for that training. I think it's extremely important. There's been a lot of changes with the SNS, and we have a lot of big events coming up in the country. And being Region 7's, treatment center at the University of Nebraska Medical Center, with the National Quarantine Unit and the only National Quarantine Unit in the country, and the Biocontainment Unit, and we have the Soccer World Cup coming. I know they'll be in Kansas City, and then we have the Olympics in 2028. So I think it's good that we are training and getting ready for any situation that may arise. Quickly, I just wanted to touch on some respiratory activity. Influenza remains low overall, but we saw a really sharp increase in those cases last week, and our total doubled in a week's time. So influenza's here just in time for Christmas and the holidays. So terrible timing, but to be expected, right? I also wanted to mention that CDC has identified a new influenza kind of subclade, if you will. So there was a little bit of a drift. So that means that there's a little bit of a genetic change in the virus, so it doesn't match perfectly with the vaccine. So again, I would push all of those really basic public health concepts of infection control. If you're sick, stay home, cover your cough, wash your hands, do all those sorts of things. But I also want to say that vaccine or vaccination remains the most effective way of preventing influenza, severe illness, and hospitalization. RSV is on the rise, so if you've got littles at home or if you've got grandparents and things, be aware again. Pertussis remains low, but watching that really closely. I think if you remember last winter, we had a sharp or an outbreak, a community-wide outbreak of pertussis in the first time in a decade. And we're continuing to watch the measles situation nationally. I think the total numbers now hit about 1,900 cases, which is more than the total of 2019, when there were roughly 1,300 cases reported, and that was the largest outbreak since measles was declared eliminated in the United States. And with that, I want to highlight some of the great work that the department has done in the past year. I think it's a good way to kind of end our last board meeting before 2026. So I was going to do a little bit of a parody of the 12 Days of Christmas and do the 12 Days of Public Health of 2025. I don't sing. I have no rhythm. I should have hired somebody to come in, but here we go. I'm going to read them to you. So on day one of the 12 Days of Public Health, we have stable funding. And I think that's huge because a lot of our partners in public health are really struggling right now. And we've done a really great job of making sure that we've been fiscally proactive, protecting our funding, avoiding any workforce reductions, and assuring continuity of essential services. On day two of public health in 2025, we received full accreditation. And this was huge. We had been working on accreditation for over a decade. I think we went through that book multiple times, pulling all of our measures, all the documentation with that. And we achieved that without any provisional measures, and that was really affirming the quality and accountability of our department. On day three, we now have an operational performance management system. So you're going to see more of that in the next year, enabling measurement of our performances, transparency, and shared accountability. On day four, we have a strategic plan that's actually not just sitting on a shelf collecting dust, and some of you were part of that strategic planning process, so thank you for that. On day five, we've changed 3 ordinances at City Council that we've talked about here today. Again, thank you, City Councilman Festerson, for all of your help with that. Again, I think that was like a decade of conversation where we were really hoping to make some of those changes. So I really feel like we are moving in the right direction. Day 6, the clinic installed an electronic medical record system. And part of that system, not only is that great, but part of that is also going to allow us to start billing in the next year for some of the services that we offer. So we're, again, looking at ways to sustain services and even potentially grow them. Really exciting. On day 7, we received a new WIC clinic site, which we desperately needed. So we're no longer in the center mall. We've relocated. They had open house, I believe just last week, or maybe the week before. But now we have a better space to serve families and for our staff. On day 8, Leah received her vending machines. I think everybody's heard about the vending machines, and they've been super successful, innovative, and really widely adopted by our community for a way to access health resources. On day 9, we completed a community health assessment. On day 10, my favorite, we have a renovated conference room. It's been absolutely transformational. If you've not been in it, you should come visit. But it's really improved internal collaboration space, and it's also allowed us to bring in community partners into our building and actually hold really important meetings and have some community engagement there at the health department. Day 11, we started some engagement with the mayor's homeless task force, and that's to ensure public health is represented in all sectors, all cross-sector solutions. And day 12, I'm going to focus on the future, and I think there's a lot to come in the next year. We've been working with a lot of our elected officials on how we can improve public health, improve our space, grow our workforce capacity, all of those sorts of things. And with that, I want to give a really sincere thank you to all of our teams at the health department, from the senior management and management team to all of our staff who are doing amazing work every single day. I think that you see us here once a month. It's really easy not to, it's easy for me not to clearly understand all of the work that goes on in the department. So I think at the end of the year, it's a really great time to reflect on that. And again, thank you to all of our staff, and thank you to all of you for coming here every month and supporting us throughout the month and the year. And with that, I'll take any questions, but have a happy holiday and a happy new year. I'll see you next year.
I just wanted to say I love it how you referred to it as Leah's vending machine.
Well, we all know that's the truth.
Any questions?
Yeah, do you have an update on the foundation?
The foundation, from my understanding, is still in process. That the paperwork has been sent to the state for to be recognized as a 403 nonprofit. We'll just stick with that.
Okay.
That's as much as I know. If you'd like, I can have Lindsay get back to you on kind of where she's at in that process.
Yes, I would like. We would like that.
Okay. I'll have her send an update about the foundation.
Thank you.
Any other questions?
Any others? No. Seeing none.
All right. Thank you.
Thanks, Justin. Any other questions on any of the department reports that were submitted? Seeing none. All right. So our next Board of Health meeting will be January 21st. Is there any need for executive session that anybody knows of? No, it doesn't look like it. All right, so I get a motion to adjourn.
Motion to adjourn, Festerson.
Yep. Second? All right. Joan?
Wade?
Yes.
McNally?
Yes.
King? Yes. Festerson?
Yes.
Jones? Rogers? Espinoza? Wilkin? Weiss?